She was born, no real issues with that.
No.
She was a little bit early. Then 3 days, her CO2 got so high that she was in CO2 narcosis. So she got the fast ride to Cardinal Glennon, where we parked there for 4.5 months.
Yep. Willa has congenital central hypoventilation syndrome, or CCHS. And the really easiest way to think about it is she has SIDS, but they caught it before it turned really bad. She doesn't breathe at all when she sleeps, so she has a trach and a ventilator.
In patients who have congenital central hypoventilation syndrome, their sensitivity to changes in carbon dioxide levels is blunted, is abnormal. They don't respond to changes in carbon dioxide, and as such, their respiratory drive is abnormal, so they don't breathe normally and they don't respond to higher levels of carbon dioxide.
She is kind of a typical crazy 2-year-old, but she's definitely given us a run for our money. She doesn't regulate, so if she gets really excited and she's playing really hard with her older sister, sometimes we have to take a step back and remind her to take a couple deeper breaths or plug her in for a little while into the ventilator so that she just has a few minutes to relax. She really is a toddler, a terror of a toddler.
So with if you take out all the accessories, she's a normal kid. I mean, she plays with her sister, she plays with us.
She plays with all her toys.
At once.
Willa learns, and she, is doing those little things that you would expect a 2-year-old to be doing. So, you hear medical complexities, or you hear all of these crazy words, tracheostomy, ventilator, everything else that you think of, and you're like, oh my gosh, but now that she's older and she's not a baby that just randomly falls asleep, which is really scary, the nurses that we have to help out during the day and at night, I mean, they really just take care of a toddler. They don't necessarily take care of a baby with a lot of complexities, even though she does have them.
They told us that Willa would never speak. Within a week of getting the trach, she could make noise.
I mean, usually it was her yelling at a doctor or a nurse or somebody, but she was still making noise, which was exciting. She signs. She has quite a few signs, but she says mama and dada, and those are really, it's incessant now, which be careful what you wish for, I guess. But the fact that she says all of those things, that's probably been our best time. I don't know what we would have done without Cardinal Glennon. We have made so many connections with people there. They check in on Willa. They want to make sure that we have everything we need support-wise, which means a lot as a family who doesn't have biological family close by. Who would have ever thought, right, that there's a genetic mutation that can cause your brain to not tell you to breathe? And who would have thought that our kiddo, our daughter, Wonder Willa, as we also like to call her, would be one of about 1,400 in the world? We kind of looked at this as just something we could do to bring even more awareness to it.